Okay. One last
Because of the deductible level with the HSA, they both are more appropriate for the bronze level.
Your product offered direct only or direct and brokers?
Direct
Insurance companies?
Yeah, direct and brokers.
Okay.
And we really value the role of brokers and are working with them. So, you know, we encourage people to get in touch with us either way. We do pay commissions.
They were telling the insurance people when this was all coming out that they were going to lose so much money they didn't get commissions anymore, and they were fighting having the Affordable Care Act passed. I have a friend that her husband, sells health insurance through a broker, private, So I'm just curious, if I go to him, I'm just afraid, is he going to try to sell me the Anthem product because he might make a commission on it opposed to your product, or?
Well, we're providing commissions to brokers. We're paying brokers. And Anthem is also on the marketplace as well, so they're subject to the same constraints and environment.
So if I am grandfathered in with a catastrophic care with Anthem, can I choose to jump into your program at a later date? I mean, I don't need to enroll it according to these states, but will you have open enrollment?
Well,
ongoing?
So for individuals, open enrollment ends March 31st, and then the next time that we can accept open enrollment will be in October of 2014 for the plan year beginning January 1st, 2015. So beginning in the fall of 2014, that open enrollment period will look a lot like the Medicare open enrollment period for people familiar with that.
Mm-hmm. Thank you.
Kevin, you might just want to add qualifying events. So
Oh, yeah,
plan,
thanks.
So you can, for qualifying life events and also for loss of coverage or end of coverage, you can enroll off that cycle that Kevin just talked about.
Thank you, Rob. Good questions. Yeah.
I'm one of those people who has a part-time job and works full-time. You're a part-time employee, but you can get 60 hours a week. But the pay rate goes back to the 1970s. All right. So for 2 years, I've been selling things and going under every month, pretty much, by maybe $100 at this point. So I'm shopping with nothing. I'm going shopping here to buy insurance. Affordable might be, what is affordable for me? My question, therefore, is when does the penalty come into effect for not spending the money if we don't have it? Because I don't want to be homeless, most of all, right? What is the penalty? When does the penalty start for us?
Sure. So
And what is it?
The penalty is either $95 or 1% of income, but it's only applied to people above 138% of the federal poverty level. So
Do you mind if I give you this microphone so I can write that down? Because I've cut out using hair dye. I haven't been to a beauty parlor in years. It may sound to you like $95. That's a lot of money if you're going into debt every month or selling stuff to keep afloat. So I'd like to write that down. If you don't mind.
Sure.
If you repeat that, what I'm in for.
Could you comment on KFF.org, healthcare.org, and your website as far as reasonableness of your estimates of monthly premiums and subsidies?
Right. So our premium estimate has gotten really good because one of the things it's pegged on is the second lowest silver plan in terms of the subsidy amounts. And so we've been able to perfect the subsidy estimate, so it's It may not be exactly what the federal marketplace comes up with, but it's going to be very, very close. So it's for any of the plans, right? Any of the subsidies, the cost share reduction really relates to that silver level plan. So we've been working on that and fine tuning it. Now KFF is a great tool. A lot of people point to it, obviously, and I imagine that they've been putting resource into it to keep it current. But I can only really vouch for ours, and we just recently really tested it and improved it.
Income level
Yes,
as well?
yeah, that's that cost share reduction.
Yeah.
So it helps not only with the lowering the deductible, but also lowers the co-insurance amount, lowers the out-of-pocket, the co-pays.
How does that work? I mean, is that based on the federal poverty level as well?
It is. So between 100 and 250%, the cost share reductions are available. And they're different bands. So between 100 and 150 is the highest level.
Right.
That's a silver level variant, 94% actuarial value, meaning 94 cents on every dollar the plan pays for.
Oh, so when it says 94 on the website,
That's
what it's
that's
referring
the
to?
actuarial value.
Because
yeah.
I thought I saw lower deductibles on some of those, and I was trying to understand
That's
that.
exactly
The
what that
website is
is.
great, by the way.
Thank you.
I think it's really good when you compare it to the federal government's. My God.
Thank
I mean,
you.
you see all these plans all laid out nice and neat.
Right.
I thought it was terrific.
That's great.
Okay,
Glad
thank
you
you.
appreciate it. Any other questions? Hey, thanks so much for your attendance, and if you have any other questions for us, we'll be here. Yes, you can call, absolutely.
I'm sort